Patients, primary health care. Now, many of us know if we got sore throat, an earache, headache, broke our arm, got a cut on our arm, we're going to go to the doctor's office or emergency room someplace and try to get taken care of. It's going to be a nurse take care of us anyway. Doctor will come in and say, "Hi, see you." Nurse, go take care of this person. Well, when we have only one place that we can go for service, either emergency room or a doctor's office, we're faced with very high bills. And anyway, we're going to get around that because they've got layers on layers on layers of people that have to be paid. Receptionist, bookkeeper, the person that processes the insurance forms, all those folks want a payroll check. Now, many of you know that this is not a new. Having the nurses in the state of Kansas allowed to provide services for primary health care is a simple modification in the law that's been in place since 1986. And by working with the Nurses Association in Topeka and some of the legislators, that simple change that allow the nurses to provide their service without the direct supervision of a physician gives us the freedom for them to open their own clinics. Those walk-in storefront clinics and malls are being used now throughout the nation. There's some 3,000 of them already in place. Walgreens here in Kansas is starting these in their pharmacies, aren't they? Have you been up to 13th in Waco? They're building an addition right there in the pharmacy. You wait for medications, you go across just literally a couple steps away, and you can walk in the door and they're going to be able to take care of some of your primary health care needs. So this is really important that we have this opportunity to do that. And what I'm trying to share with you, that doesn't cost us as taxpayers anything, does it? It's a simple change in the law that says here's how you can go about opening the door, and with that you allow people to get in and be taken care of when they're first sick or injured. That's really the key, isn't it? If we have to wait till we're really chronically ill and we've got emergency now written all over our face, we're about to shut down all of our body systems, that's pretty late in the game. We're talking about how to provide the services when you're first sick or injured and keep those costs down right at the beginning. Okay, number 4, we're talking about here ability to write prescriptions and ask for lab tests. Not only should the nurses and the physician assistants be able to offer the services, but they need to be able to write a prescription so you can go down and if there is a medication you need, you can get it. Right now the law says you've got to have this physician who's got to be within 30 miles. Well, that means what? The physician has to come around on a weekly basis and check all your orders and see if you did it right. Well, many of these things are fairly standard. And a lot of lab tests too. If you need an x-ray, you need an x-ray. If you need a urinalysis, get the urinalysis. Don't have to wait for somebody to sign off and say, yes, you needed a urinalysis. Get it, have the results come back to you, read them, decide what to do next. That's how we make decisions. But to put somebody else in the loop means that every time they're in the loop, prices go up, services go down. Number 5, what about malpractice insurance? Did you get one of these handouts?
Yes, I did. I just read it.
Number 5 is a real opportunity for us to talk about how to hopefully bring down the cost for the doctors. They're trying to make a living. I am not here to badmouth anybody, particularly not doctors. They take care of us. Many of them are very honest and hardworking people, very long hours. The issue is how do we help them and help ourselves in the process. Malpractice insurance is there not only for physicians, but the way the insurance company set it up is for small groups, kind of like for the small business person, right? If you have 5 employees, you have a group policy for 5 employees, the premiums are really high. But if you have a statewide policy, now you lower the risk, you lower the premiums, you lower the cost, and those cost savings can be passed on to the consumer in the form of how much do I pay you now for what you just did. This is a very simple concept, again, using market forces to bring costs down in a very real way. Moving right along, number 6, we're looking for ways here to establish healthcare centers. Now, why 24 hours? Because people don't get sick under an 8 to 5 time frame, right? I've never known myself in the middle of the night to say, well, doctor, are you ready to see me? He's not even there to answer the phone, let alone be in his office. But we are frequently, as biological beings, needing to have care. So let's do it. Let's have these facilities available. We do it for pets. There are vet clinics that are open 24/7. Huh? How about for people? Simple concept, isn't it? All right. That can pay for itself by the folks being able to get in when they're first sick or injured, be able to be dealt with as they come in the door. Now, number 7 is similar to what we talked about for physicians, although in this case it's you and I. Why is it we have the insurance companies dictating the premiums? Right now it's a love fest with money, right? Costs go up, premiums go up, costs go up, premiums go up. We've talked about that earlier. However, if you set it up so that you've got a group policy that's statewide, now you're not held to having your insurance with just your employer. You decide you want to leave, go take a different job, or your spouse is transferred to a different city and you have to move, whatever. Why shouldn't that transfer your insurance policy with you? Now you're in a situation where you say, hey, by golly, if we have a statewide policy, now we've lowered the risk, we've lowered the premiums, we've lowered the cost for everybody. So you've got now coverage under one company, but that company is able to provide services throughout the state of Kansas and probably have 8 or 10 different policies. You're not just stuck with one policy to fit all. You know that. Young folks, older folks, middle-aged, you're going to have different kinds of needs. So you set this up so that you've got a contract with the insurance company, but the group is statewide. All right. Let's talk about a number, number 8. Here we're dealing with, again, a concept that makes a whole bunch of sense. If you buy in bulk and you buy generic, you brought the cost of medications down. I have so much disdain for the pharmaceuticals companies. Every night I turn on the news, I want to listen to the news. What I get is, ask your doctor, ask your doctor, ask your doctor, right? They want to sell us more and more of their pharmaceutical pills, right? But the only way we can get them is go to your doctor. Many of us already know what to take. Many of us have already had a prescription. If we're able to buy in bulk and buy generic, then the costs come down dramatically for everybody who needs that particular kind of medication. And that's hundreds of them. You see Dillon's are offering $4 generics, right? You see Walgreens, many of them, Walmart, have gotten the point. They're saying, all right, hey folks, time to stop this. People aren't going to go broke just to stay healthy. Okay, number 9. I'm trying to stay within this 20-minute idea that we have. It's a good idea. Number 9 is to require the medical providers to publish their fees. Wouldn't that be something? I don't know whatever industry there is where you come in and you say, hey, take care of me, and then you have to say at the end of the day, oh, by the way, how much did I fill this check in for? I am a businessman. Among other things, I ask people up front, what's it going to cost me for such and such? How soon can I get it? How soon will you have it here so I can have an opportunity to make use of what I just purchased? We don't get that with the healthcare system. They want it to be a blank check. Now, they provide a list of, quote, fees for service to the insurance companies, right? To get billed, you have a code. The code is tracking itself to a particular service you provided. That goes to insurance companies. We need transparency for ourselves, don't we? We need to know up front so we can make intelligent decisions about how we provide for our own health care. Moving right along, number 10 is to end the practice of charging